and security experts today discussing South Africa's risk outlook for 2023 at a meeting that's just ended in Rosebank in Johannesburg this afternoon. They're looking at the country's socio-economic outlook and its potential impact on security. Climate change and other health risks, such as workforce well-being and mental health, are just some of the items that were on the agenda. To tell us all about it and how it's gone and some of the outcomes, I'm joined now by Dr. Chris van Straten, who is a global health advisor for clinical governance at International SOS. Chris, good afternoon. Welcome to today. Thank you very much for your time. Just an overriding question first. How did the webinar go?
And thanks very much. And it was actually an incredibly well-attended session with corporates from South Africa, but also global companies joining us in the room. And it was well received and also really good questions. So I've walked away from that feeling content, actually, and that we got the message across.
We got the message across, but South Africa is in trouble. I mean, if you look at the kind of topics that you were discussing, according to your media advisory about this, I mean, there's a socio-economic situation. We know our economy is not growing. In fact, in the last quarter of 2022, it notched a negative 1.3% GDP, and we've seen the impact of climate change with the floods, for example, last year in KwaZulu-Natal, and infrastructure being damaged.
Absolutely, Dan. So, yes, the challenges are real and significant and not to underplay that. However, where there's challenge, there's also opportunity. And what was encouraging to see is, A, the interest in South Africa and Southern Africa and Africa as a bloc. What's also great to see is, one, there's still significant interest in the continent, and how do we mitigate these challenges we're having? And for example, with the Ipsos Mori, that's what this is based on. It's a cooperation between International SOS and Ipsos Mori based in France. They do research, and they interviewed over 1,200 global leaders in business, health security experts in these different companies to see what are their focal points, globally, but also in the African context. And I'm just going to share some of those findings. And there were really 5 key takeaway messages. The first is, and this is across the board, whether you're operating in Africa or in Europe, or you need to make sure you're getting information that is timely, that is accurate, and that you're able to contextualize, in other words, analysis of that information so you can act appropriately. And in the African context, that's the service you're providing, but also other journalists, media houses, data centers. How do we support that? And can there be that private government interaction and also more the academic? Then a term that came up repeatedly in this conference and others is clients and businesses using the term perma-crisis. It can feel like we're in a never-ending cycle, whether it's the conflict in Europe, whether it is storms or weather events, COVID, pandemics, etc. And that comes with a burden, and that speaks a bit to the context later of mental health. How do we address that? How can we support mental health in the workforce to prevent absenteeism, to promote people getting the job done and getting a job done well? Then for travelers, yes, Dan?
Yeah, let's come closer home in the interest of time, Chris. I mean, the current socio-economic context of South Africa is pretty bleak, if I may say so. I mean, the country has just been grey listed, as an example. The economy is not growing, and unemployment is still stubbornly high. But your discussions today, we're looking at that and the impact on security in South Africa. What came out?
Yes, Dan. So from a security perspective, the security experts did comment on, as you said, the economic pressures, the pressure that puts on the average person on the street, and therefore we can expect to see, like you've been reporting today, perhaps strike actions and damage to property, etc. So there are concerns about, and businesses either in the country or looking at the country will take into consideration, but they can also take mitigating actions or steps, they feel. So pre-forewarned, places to avoid, and then trying to, how does one engage with an activity boosting the economy? The other topic that did come up again from a security perspective, health perspective, is the blackouts. the rolling blackouts, what can be done about it? Can something be done about it, and how quickly? And again, that's more with the government's angle and what Ramaphosa, I think, has recently done with the new minister. So the challenges certainly are real. And what these companies are looking at is, can they mitigate those risks when operating in South Africa?
Yeah, when my editor, Peter Mutlotsi, discussed this interview with me, I was drawn to the other aspect, which I'm pleased to see that it's being put on the risk outlook table, workforce well-being and mental health. Because every time we've discussed this issue, it's been very clear that since the pandemic, mental well-being has become one of the primary concerns of society, and it has grown tremendously. We've seen the amount of anxiety and depression, for example, in our country, and the number of suicides that we are seeing. But when it comes to organizations looking at this, what was the discussion today? I mean, are organizations being encouraged to prioritize this, to come up with strategies on how to mitigate this risk, especially because of what you said, Chris? We live now in a perma-crisis.
Yeah. Dan, I think you phrased it better than I could. We are in a perma-crisis, and it takes significant mental toll on all of us, including myself. And Dan, I was really encouraged with what I heard today. First off, we did hear that certain cultural backgrounds, I speak for myself, some of my family background, if I think of my grandparents' generation, we didn't talk openly or easily about feelings or weaknesses. And that was, people spoke about that today and saying, we need to bridge that. How do we speak about these issues? I mean, it's been gender issues. It was women's health, women's rights day, and women's putting women first, but also how do men speak about issues? How do we speak about these? And in the workplace, what I have seen, and I'm encouraged, this is especially looking at if healthy and they can support them, they tend to produce better work. And I think it is important. I think we've got to keep talking about it.
Unfortunately, we just lost that connection there as Dr. Chris van Straten was concluding his remarks. He's a global health advisor for clinical governance at International SOS. A webinar just ended in Rosebank in Johannesburg, where they were looking, a number of experts, local and global, looking at the risks outlook for 2023. It's a mixed bag of risks. Thank you.